Okay. Good morning. Will you start by introducing yourself, please?
Yeah, I'm Sarah Potter, and I'm a physician assistant in the Kansas City area. I work at a clinic called the Casey Care Health Center.
Will you tell us a little bit about yourself, like where you went to school, what did you study, and how your career has progressed?
So for undergrad, I went to Creighton University in Omaha, Nebraska, and I studied biology. And then I went for grad school, for PA school, I went to St. Louis University and got my master's in medical science. And I went straight from undergrad to grad school, which is a little atypical for PAs. Typically, they take some time off, but I did go straight from undergrad to grad school.
Can you describe the roles and responsibilities of a physician's assistant and how that differs from other healthcare providers?
Sure. So a PA is what we in the Midwest call mid-level providers. Across the country, they're kind of called physician extenders or other terms. But we are very similar to physicians, especially in a primary care and outpatient setting, where we have our own patient panel. We see our own patients, make our own treatment plans, prescribe medications, do procedures. But we function alongside physicians in that it's a team model. We involve them in the care when we think it's necessary. PAs are very similar to nurse practitioners, especially in that outpatient primary care model. One thing that's the main difference, I think, between PAs and NPs is that PAs, their schooling is what we call in the medical model, where it's attached to a medical school. NPs are in the nursing model, where they're attached to a nursing school. They're both master level degrees, but NPs tend to choose an area to go into. So if that's like geriatrics or pediatrics or women's care, they can do primary care or inpatient, whereas PAs are trained in all the areas. So it's more common to see a PA jump around from area to area. In the Midwest, you're going to find PAs more actually in hospitals doing surgeries, being in the ICUs, and you're going to find NPs, I mean, this is very general, but usually more kind of in pediatrics and women's health. But sorry, my cat is here. But very, very similar roles. And I would say that if you specialize as a PA, so you're working in a hospital or doing like oncology or orthopedic surgery, you have a little bit more of that team model with your physician where you're paired up more and working together. Whereas if you're doing primary care, outpatient, you have more autonomy and function more independently. So it kind of depends on what area you're working in.
So can you talk us through a little bit about what the education process looks like?
Sure. So you get your undergrad degree, and that can be in anything. It's very similar to like a pre-med track where you have different requirements to get into PA school. Sorry.
She just wants to be on TV.
I have a spray bottle up here to scare her away, and it's clearly not working. You can major in anything you like. Most of the time people will major in something like biology or chemistry because they're already having to take those classes to get into PA school. But you don't have to. You can major in Spanish, you can major in psychology, and then just take extra classes. And then the coursework for PA school is rigorous. It's usually about 27 months. Most programs don't have any breaks. And it's a similar coursework to medical school. It might be faster paced than medical school. And it tends to be, they kind of expect you to hit the ground running and they don't repeat a lot of courses. So for instance, if you took microbiology before PA school, you're not going to repeat it in PA school where you might in medical school. So they kind of expect you to hit the ground running. And then the major difference between PA school and going to medical school would be the rotations and then the residency. So medical students have 2 years of being on rotations, clinical rotations, whereas PAs have 1 year. And then medical students will go on to do a residency and train in a specific area, whereas PAs do not have that residency. There are now some residency programs, especially in internal medicine for PAs and in critical care, but most of the time, once you graduate from PA school, you start working. So.
How did you determine that this was the career path for you?
That's a really good question. So I had no idea what I wanted to be in undergrad. I thought for a while I wanted to be a pharmacist, and then I realized I hated organic chemistry, so I could rule that one out. I thought about nursing. I thought about occupational therapy, physical therapy. Thought about a lot of different things. I never thought about being a physician. That does not appeal to me. It still does not. And I think that's important to know that I think the personalities of people who go into being a PA versus medical school are very different, and the careers can be quite different. So being a PA is definitely not it's not like a fallback for medical school. I think people tend to want to do one or the other. So I never thought I wanted to be a physician. When I was a junior in undergrad, I worked on a cardiac unit at Creighton Hospital, and I just came across some PAs, and that was the first time I even figured out what they were. And I really liked how they treated patients, what their role was in the hospital, how they were very autonomous and made their own decisions, but at the same time, it was a team effort with the physician. And I think, like my personality, I've always been a team player. At the end of the day, I'm okay not making final decisions if it's a really complex case. I like seeking help from others and opinions from others. So I think that's what drew me to it, was that I would get to practice medicine, but have a little bit more flexibility in my career, as well as conceptually a little less stress, which I'm not sure if that's true or not, but that's what I was thinking at the time. So.
So tell us a little bit now about, I know that you have an interest in HIV medicine and community health. How did you develop that interest, and how does that change what you do on a daily basis?
Yes, so I've worked in community health for 7 years. When I graduated, I moved to North Carolina and worked in community health there at a federally qualified health center, and fell in love with it. And I can't really imagine doing anything else. So when I moved back to Kansas City, I found another FQHC to work at, and that's where I work at now. As far as, I've always been interested in infectious disease in school. That was always something that interested me. And it just so happened that when I moved back to Kansas City, the community health center I started working at specializes in HIV care. They also specialize in hepatitis C, hepatitis B. So I had the opportunity and was surrounded by colleagues who were able to train me in HIV medicine. Missouri, it's called MATEC, Missouri AIDS Training and Education Center. They offer a year-long residency type program for NPs, PAs, and MDs and DOs. And then you become certified. You can sit for boards and become certified in HIV medicine. So I was able to do that over the course of a year while working to become certified. So right now, I only see HIV patients and transgender patients. So 100% of my patients are pretty much HIV and transgender. And I think, so it's more of a specialty role now than what I've done in the past, because in the past I did primary care. So I would say that changes things in that while I can still be completely autonomous, I am new to the area. So I talk to the physician I work with and who has trained me more in decision making because I'm still learning that area. And then I think, as the years progress, how much I would have to consult him and work with him on patients would decrease. But it's all very fluid. It's all about having a good working relationship with the physician that you're paired with. And so I'm very lucky in that all the physicians I've ever worked with have really respected PAs and have let me do what I want to do, trusting that I will come to them when I have questions. So I hope that answers your question.
Yes. Just to dive a little bit deeper. So what challenges do you face with helping HIV patients and transgender patients that might be a little different from a family health setting?
Well, so I would say resources. So for my transgender patients, they face a lot of problems with getting resources. So by the time that they come and find us in our clinic, sometimes they've traveled hours from small towns to get to us. Oftentimes people don't have insurance. All of my patients at community health centers struggle with the insurance issue. So that's always tricky, having to think outside the box with medications and hormones and what they can afford, getting them surgeries that they can afford, things like that. I think specifically for my HIV and trans populations, mental health is usually a concern. And so we're really lucky to have counselors in clinic and psychiatrists in clinic. We have a psychiatric PA actually, he specialized in psychiatry. So my patients can typically get what they need, but that's a unique thing. People living with HIV tend to have higher rates of STIs, of substance abuse issues, transgender individuals. So I think like the psychosocial of people living with HIV, transgender, is a little bit more complex. But in general, when you're talking about a community health center and people who are underinsured and living in poverty, you're gonna have those same psychosocial concerns. So I would say it's a little bit more than usual than my patients that I have in North Carolina, but not a lot more.
What challenges do you face on an average day in your profession, and how do the rewards make up for the challenges?
So working in a community health center is incredibly difficult for all the healthcare providers, whether that's the NPs, PAs, MDs, our counselors. That environment is a very chaotic and stressful environment. It's also can be sad with the population that we work with. It's difficult when you can't get your patients what they need. And we certainly I have had patients die because of not being able to access what they need in our healthcare system. So I would say by far that's the most difficult, is just working in an under-resourced area. I think the rewards though is that when you are able to figure out a way to provide.
Sorry, my husband just popped in and scared me to death.
I think I'm glad it's just your husband. It looks like it could have been an intruder or something.
No, I know. Oh, sorry.
Okay. But that being said, I think every time that you're able to provide for a patient and have a success, it makes up for all of the failures. So you know, when you're passionate about that kind of work, it takes very little to remind yourself why you do what you do. So.
And I know that you have something that you do on the side in photography, and I've seen that with a lot of healthcare providers. So is that a way that you try to have some work-life balance or express yourself creatively, or explain
Absolutely. Yeah, both of those things. So I started doing photography in North Carolina, absolutely for to have a stress reliever. And so I found, I didn't do really on purpose, but I got a camera and then I realized that when I was learning and taking photos, I was able to focus only on that. And so I just kept doing that because I realized that you really need time out of mind where you can't think about your patients and you can't think about work and the stress in order to continue doing the work that you're doing. I think most areas that you go into in medicine, you need to have something that can fulfill you outside of work. Because if you get too mentally and psychologically involved at work, it can be very detrimental, and there's a huge burnout, especially in primary care, especially in under-resourced areas. Providers get very burnt out and are not able to do it long-term. And so I think if you want to do it long-term, you have to take care of yourself as much as possible. So,
this is my last question. What advice would you give someone interested in becoming a physician's assistant?
As far as like getting into PA school, or just like whether or not to choose the career?
Let's do both. For some of
Okay.
our classes will have something to
Yeah.
consider.
Um, so I would say, as far as getting into PA school, the more experience you can have outside of the classroom, healthcare experience, before you go to PA school, the better. So I had some, but not nearly as much as other people in my class. I was the youngest person in my class coming straight out from undergrad, and I don't really recommend that. I teach over at UMKC's PA school, and they're a newer program, and I know a lot of them take younger students straight out of undergrad, and they do very well academically. But I found personally that um, it would have been nice to have had a mental break from school and to have been out more in the real world and seeing how things work. Because again, as a PA, you don't have a residency to learn how the real world works in hospitals and in clinics. So it's nice if you have that before going to PA school. So that would be my advice, is like, don't be afraid to take off a year or two, get some really good experience in clinic before you go to PA school. As far as being a PA goes, I mean, I think it's a great career. I highly recommend it. Every PA I know does not regret the decision and recommends being a PA. I think it's a very flexible career as far as being able to move around to different specialties. I would say that the best PAs are those who are good team players and are humble and can admit mistakes when they don't know something. And that's what makes a good PA. So if you know you're not that person, then you may not be a really like safe PA, because to be a safe PA, especially early on in your career, is to acknowledge when you don't know something and be willing to work with other people and ask for help. So that would be my advice, is if you're kind of trying to choose between things, that would be the personality that would do well in a PA career. And then it is stressful. You are making patient decisions oftentimes by yourself. You do have a lot of responsibility on your shoulders. And so then just kind of thinking through whether or not that's something that you could do long term.